Hi, I'm Dr. SenGupta of Dr. SenGupta and Associates. I've been involved in dentistry for the last 22 years. My primary focus in dentistry over the last some 20 years has been dental implants and indeed cosmetic dentistry. A dental implant itself, it's an artificial tooth root. When a tooth is missing, the best or the ultimate way to replace that missing tooth is to insert an artificial tooth root onto which we put a post, onto which we put the final crown. Traditionally, we would the other alternatives to replace a missing tooth would be with a removable denture that I'm sure many people are familiar with, or they will have parents or elderly relatives who indeed have dentures, and sometimes they're held on with clips and clasps that hold these dentures in place. And that's been a technology in of itself. It's an area of dentistry called prosthodontics, and there's certainly a place for it. And indeed, that's all we've had access to. And then in the 70s and 80s, there's a big dramatic change in dentistry when this new concept was discovered, where you can actually get a certain metal called specifically titanium that can connect to bone in such a way that it will not be discarded by the body, and that the metal titanium will be accepted under certain circumstances if a post is placed in a special way. The bone will actually biologically accept the metal, and that way that will form an ideal foundation for us to build a tooth. The analogy I always use when I explain to my patients about dental implants is just think in terms of a house, in terms of the foundation, the walls, and the roof, and the finishing. The foundation of the house, you don't actually see the foundation of a house, that's underground. And that, in effect, is the actual implant. So what you see is everything that goes on top of the implant. And so that effectively is like the walls or the roof, is the facade, is the outside, and that's a functional part of it. So for all intents and purposes, I could have implants and you wouldn't know. If they've been done well, there will be no reason that you know that I've actually got implants. And those implants are replacing my missing teeth. The other classic way that was historically done to replace missing teeth was to actually aggressively cut the teeth on either side of the space. So if one tooth is missing, we would actually we would put a false tooth in between, but we would connect that false tooth to the neighboring teeth on either side. And in order to do that, we would have to cut down sometimes perfectly healthy teeth to facilitate that. So as I say, from about the 70s onwards, everything changed because with the advent of implants, we no longer have to touch those teeth. We just deal specifically with the missing tooth.